All India Radio presents Morning News. Good morning, I'm Sunil Verma and with me is Vaibhav Jyotsna Srivastav. The headlines. Home Minister Amit Shah reviews coronavirus situation in national capital. Calls for fresh demarcation and strict monitoring of containment zones. Mizoram extends total lockdown till 30th of June. More than 2 lakh people successfully cured of coronavirus infection so far. Defence Minister Rajnath Singh asks top military brass to ensure strict vigil on Chinese activities around land border, airspace and sea. Centre sanctions 190 crore rupees for augmentation of healthcare facilities in northeastern states. Procurement of minor forest produce by government touches an all-time high, giving boost to tribal economy. Union Home Minister Amit Shah has chaired a high-level review meeting to discuss the coronavirus situation in Delhi. A report on containment strategy on COVID-19 in Delhi, prepared by the committee headed by Niti Aayog member Dr. V.K. Paul, was presented during the meeting yesterday. The containment strategy, determined by Dr. Paul, has asked to revise demarcation of containment zones and a strict monitoring and control of activities in such containment zones. It has asked to conduct contact tracing and quarantining of contacts of all infected persons with the help of Arogya Setu and Itihas app. The report suggests listing and monitoring of each household even outside containment zones, which will help in getting comprehensive information about Delhi. The report also recommended to keep COVID-19 positive cases in hospitals, COVID care centres or home isolation and proper functioning of COVID care centres, and taking the help of voluntary organizations and NGOs in this regard. It has been decided that serological survey will be conducted in all of Delhi from 27th of this month to the 10th of next month, in which sample testing will be held of 20,000 persons. This will help in comprehensive assessment of the spread of the infection in Delhi and will help draw up a comprehensive strategy. As per the plan proposed by Dr. V.K. Paul, every district in the national capital will be linked to a major hospital, which will provide adequate help. The proposed report also includes a timeline for all of such activities, based on which the Delhi government will finalize a plan by 22nd of this month and will issue revised demarcation of all containment zones by 26th of June, as well as 100% survey of containment zones by 30th of June. A comprehensive survey of the rest of Delhi will also be done by 6th of next month. During the meeting, the Home Minister also directed the Delhi government to conduct assessment in respect of every deceased in regards to how many days before death the person was brought to hospital and from where. A special focus has been given about whether the person was in home isolation and whether the person was brought to hospital at the right time or not. Every death has to be reported to the central government. Mr. Shah also said that all coronavirus positive cases should be first referred to COVID centres, and those who have adequate facilities at home and do not suffer from other comorbidities can be allowed to stay in home isolation. The central government will also be informed of the number of people kept in home isolation. The meeting was attended by Union Health Minister Dr. Harshvardhan, Delhi Lieutenant Governor Anil Baijal, Chief Minister Arvind Kejriwal and senior officials.
Meanwhile, a total of 3,000 new confirmed cases of coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 59,746. Delhi government has confirmed that over 33,000 people affected with coronavirus have been cured so far. In the last 24 hours, 1,719 people recovered and 63 deaths were reported in the national capital, taking the death toll to 2,175. The central government has said that a total of 2,27,756 people affected with coronavirus have been successfully cured so far. With this, the recovery rate of COVID-19 cases has reached 55.49% in the country. During the last 24 hours, 13,925 people have recovered from COVID-19. Presently, the total number of active corona cases in the country is 1,69,451. Health and Family Welfare Ministry said a total of 15,430 new cases of COVID-19 have been reported in the last 24 hours, taking the total number of cases to 4,10,461. This is the highest number of cases registered in a single day since the outbreak of COVID-19 pandemic in the country. In one day, a total of 306 deaths have been reported, taking the nationwide toll to 13,254. With this, the case fatality rate reached to 3.22% in the country. Indian Council of Medical Research, ICMR, said that a total of 1,90,730 tests of coronavirus samples were conducted by various laboratories in the last 24 hours. The insurance scheme announced under Pradhan Mantri Garib Kalyan package for health workers who are fighting to contain the COVID-19 pandemic has been extended for another 3 months till September. The scheme provides an insurance cover of 50 lakh rupees to over 22 lakh public healthcare providers. They include community health workers who may have to be in direct contact and care of COVID-19 patients and who may be at risk of being impacted by this. Earlier, the scheme was slated to end on 30th of June. The scheme is funded through the National Disaster Response Fund operated by the Ministry of Health and Family Welfare.
The Mizoram government has extended the ongoing total lockdown in the state capital, Aizawl, 10 other district headquarters and containment areas for another 8 days till 30th of this month to contain further spread of coronavirus infection. In an order, the government said that it extended the total lockdown as stricter measures imposed earlier were found to be effective in containing the spread of COVID-19. The total lockdown was imposed on 9th of June after the number of coronavirus cases in the state jumped from 1 to 42 in a week. It was scheduled to be enforced till today. Mizoram yesterday reported one fresh case, taking the state's tally to 141, of which 140 were returnees. There are 132 active cases in the state, while 9 have recovered from the virus. Uttar Pradesh Chief Minister Yogi Adityanath has asked officials to strengthen the surveillance system of COVID in the case and prepare a strategy to identify the patients. He said that every COVID patient in the state should reach hospital as early as possible. More from our correspondent.
Addressing a high-level meeting yesterday, Chief Minister Yogi Adityanath said that surveillance system is important in early identification of COVID infection and this should be strengthened with the help of ASHA and Anganwadi workers. He also instructed officials to complete the screening work of migrant workers by this month and increase the number of COVID tests to 25,000 per day. Principal Secretary Health Amit Mohan Prasad said that more than 5 crore persons have been screened by teams of health department in the state. Random samples are also being taken from different clusters including urban slums, old age homes and women hostels. Currently there are 6,186 active cases in all 75 districts of the state. Sushil Chandra Tiwari, AIR News, Lucknow.
In Gujarat, 580 new COVID-19 positive cases were reported during the last 24 hours, taking the total number of cases in the state to 27,317. 25 patients have lost their lives, taking the total deaths toll to 1,664. More from our correspondent.
Following the discharge of 655 patients yesterday, the total number of patients recovered from COVID-19 has gone up to 19,357. According to official sources, out of 6,296 active cases, conditions of 6,237 are stable, while 59 patients are on ventilator support. More than 3,24,000 COVID-19 tests carried out till date. Meanwhile, Do Yoga Beat Corona campaign on International Yoga Day gets big support of the people. Chief Minister Vijay Rupani said that this campaign on social media helped in creating awareness among the people. Yogesh Pandya, AIR News, Ahmedabad.
Telangana recorded yet another highest single-day jump in COVID-19 infections yesterday with 730 new coronavirus positive cases. With this, the total number of COVID-19 cases in the state has gone up to 7,802. Meanwhile, 225 persons in the state have recovered from COVID-19 infection, taking the total number of people cured so far to 3,731. The state also saw 7 deaths during the last 24 hours, pushing the death toll due to coronavirus and other comorbidities to 210. In Puducherry, the number of COVID-19 positive cases have started rising since the relaxation in lockdown was given in the beginning of this month. During the last few days, cases have been rising very fast, and it has been a matter of concern for all. Puducherry Chief Secretary Ashwani Kumar has said that heavy pressure is mounting on the health facilities to accommodate the new cases and requested people to cooperate with authorities. Here's a report.
Chief Secretary Ashwani Kumar said that if somebody is coming from outside of Puducherry, should get in touch with the administration or health officers if they have not reached out them. It is a duty of the public also to register their arrival and tested. In case, if any symptom found, do not hesitate to approach the health workers. Mr. Ashwani Kumar further said that a timely detection is very, very important and that would help for testing. In case if found positive, easy to isolate, thereby the disease will not spread to others also. He added that everybody should download Arogya Setu app for timely notification. Chandramohan, Air News, Puducherry.
A special flight under Vande Bharat mission carrying 125 Indian medical students stuck in Kyrgyzstan landed in Indore at Devi Ahilyabai Holkar International Airport last night. The Air India flight, which took off from Kyrgyzstan capital Bishkek, reached Indore via Delhi. A health department official said all the students will be quarantined in their respective districts for a period of 14 days as per the guidelines.
In Sri Lanka, the third flight under Vande Bharat mission and first from Colombo to Delhi took off this morning. The Air India flight carrying around 240 Indian nationals will also fly to Lucknow and Gaya later today. Earlier, the two flights carried passengers to Mumbai, Bhubaneswar, Kolkata, Kochi and Bengaluru. Indian High Commissioner Gopal Bagle thanked Sri Lankan government for the help extended in making the operation smooth. Around 700 Indian nationals were evacuated by Indian Navy ship INS Jalshava earlier this month to Tuticorin in Tamil Nadu. Around 2,000 Indian nationals have registered with Indian High Commission in Colombo for repatriation. In our series, Experts Speak on All India Radio, we bring you views of leading medical experts in COVID-19. Talking to AIR News, Dr. Amarchand Bajaj, Senior Consultant at Sri Taram Bhartiya Institute of Science and Research, New Delhi, highlighted the importance of hygiene and how to maintain it to contain novel coronavirus.
हमें जो प्रिकॉशनरी मेजर्स है वो फॉलो करने हैं। जहाँ जरूरत ना हो उसमें घर से बिल्कुल बाहर ना निकले, कोशिश करें कम से कम बाहर निकलना है। और जब कि निकलना भी पड़ा घर से बाहर तो कोशिश करें कि जहाँ आप दो लोग खड़े हैं करीब 2 मीटर दूर खड़े रहें, नहीं तो कम से कम 1 मीटर दूर खड़े रहें।
Naresh Gupta of LNJP Hospital Delhi said that in most of the cases the COVID-19 infections are self-limiting and very few patients are required to take admission in hospital.
आईसीएमआर ने एक नई तकनीक लगाई है एंटीजन टेस्टिंग की, उसमें आपको आधे घंटे में ही रिजल्ट मिल जाता और वो रिजल्ट वहीं पे मिल जाता। अभी इसको इसलिए लाया गया कि जिस जगह पे हॉटस्पॉट्स हैं वहां जाएं और वहीं पे टेस्टिंग करके वहीं रिपोर्ट देके वहीं फैसला कर लें कि इधर क्या करना है, उनको क्वारंटीन करना है, उनको केयर हॉस्पिटल में भेजना है या और ज्यादा सिक हैं।
The News Services Division of All India Radio, in its bilingual live phone-in program tonight, will bring you a special discussion on COVID-19. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR.
Head scientist in the Epidemiology and Communicable Diseases Division of the Indian Council of Medical Research, Dr. Raman R. Gangakhedkar, has said that the only way to reduce COVID infections is by taking all necessary precautions. He was speaking while participating in the AIR live phone-in program on COVID-19.
इस बीमारी की वजह से मौत होने का चांस कम है और अगर मौत नहीं होती है तो इसका मायना जो डिस्चार्ज हो रहे हैं उनकी भी संख्या उतनी ही बढ़ते जा रही है, इसलिए रिकवरी रेट भी बढ़ते ही जा रहा है। लेकिन हमने एक ही समझना है कि जब हम देखते हैं संक्रमित लोगों की संख्या जब बढ़ रही है उसको अगर हमको कम करना है तो हम सबको अपने आप को और अपने परिवार को सुरक्षित रखने की कोशिश करना है।
Dr. Gangakhedkar said that people should not be afraid of testing for the infection. He also said that lack of testing can deprive patients of necessary medication.
टेस्ट करने को जाना चाहिए, क्योंकि मैं जितना लेट जाऊंगा ये बीमारी के खिलाफ जो सपोर्टिव ट्रीटमेंट मुझे देना है या जो नई दवाइयों के बारे में अभी जो चर्चा हो रही है उनमें से कोई दवा अगर मुझे जरूरत होगी वो मुझे अगर मिलना है तो वो मैं मिलने से वंचित रहूंगा और ऐसे अगर हुआ तो अपने आप ही अपने को खतरे में डालूंगा।
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Home Minister Amit Shah reviews the coronavirus situation in the national capital, calls for fresh demarcation and strict monitoring of containment zones. Mizoram extends total lockdown till the 30th of June. More than 2 lakh people successfully cured of the coronavirus infection so far. Defence Minister Rajnath Singh asks top military brass to ensure strict vigil on the Chinese activities around land border, airspace and the sea. Centre sanctions 190 crore rupees for the augmentation of healthcare facilities in northeastern states. And procurement of minor forest produce by the government touches an all-time high, giving boost to tribal economy. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
अपने साथ अपनों का ध्यान रखो, बड़े बुजुर्गों का तुम ध्यान रखो, तो बात करो, कुछ मदद करो, कोरोना के चलते याद रखो, घर से निकलो तो मास्क पहनना, मास्क के पीछे मुस्कुराना, सुरक्षित दादा दादी नाना नानी अभियान, अपने साथ अपनों का ध्यान।
Defence Minister Rajnath Singh has held a high-level meeting with Chief of Defence Staff General Bipin Rawat and 3 services chiefs on the situation in Ladakh. Our correspondent reports that after the review meeting yesterday, armed forces were given full freedom to deal with any aggressive behavior by China's PLA along the line of actual control LAC. The meet also discussed adopting a different tactical approach in guarding the border with China henceforth. Top military brass was also told to ensure strict vigil on Chinese activities around land border, airspace and in strategic sea lanes. Union Minister of State for Home, Kishan Reddy, met family members of martyred Colonel Santosh Babu at Surapet in Telangana last evening and assured that the centre would stand by them in all respects. The brave heart made the supreme sacrifice for the nation during a face-off with Chinese forces in Ladakh recently. Speaking to media after paying respects to the martyred soldier, the minister said that Indian Army has been given full and unconditional freedom at the borders to safeguard the territorial integrity of the country.
Union Minister for Development of North Eastern Region Donair, Dr. Jitendra Singh, reviewed the COVID-19 status and healthcare facilities in aspirational districts with special focus on the Northeast. The minister disclosed that in the wake of coronavirus pandemic, the Donair ministry has decided to sanction 190 crore rupees for the augmentation of healthcare facilities in the 8 northeastern states, particularly for developing infrastructure for management of infectious diseases. Dr. Singh was addressing a virtual meeting attended by the health secretaries as well as deputy commissioners and health officials of the 14 aspirational districts of the Northeast. He said the Donair ministry has given the northeastern states the option to send proposals for health-related projects to be funded up to over 500 crore rupees from Northeast Special Infrastructure Development Scheme. He said, accordingly, proposals have been received from the states of Assam, Arunachal Pradesh, Meghalaya, Manipur, Sikkim, Mizoram and Nagaland, while the proposal from the 8th state of Tripura is awaited. Dr. Jitendra Singh also complimented the aspirational districts of Golpada and Dhubri in Assam for having achieved Ayushman Bharat coverage of nearly 185% respectively. The procurement of minor forest produce MFP by the central government has touched an all-time high, giving boost to the tribal economy. The ongoing procurement under the minimum support price for MFP scheme in 16 states has hit a record-breaking high, with the procurement touching 79.42 crore rupees. With this, the total procurement for the year, both government and private trade, has crossed more than 2,000 crore rupees. this has proved to be a much-needed panacea during the times of the COVID-19 pandemic, which has disrupted lives and livelihoods of tribals. With the injection of over 2,000 crore rupees in the tribal economy, the MSP for MFP scheme can lead in the transformation of tribal ecosystem and empowering the tribal people.
Prime Minister Narendra Modi has said that the practice of yoga boosts immune system against COVID-19 virus. In a televised message on 6th International Day of Yoga yesterday, the Prime Minister said the world is realizing the potential of yoga in the coronavirus pandemic, and people affected with the infection are taking the benefit of yoga. He said coronavirus hits our respiratory system, and several breathing exercises like pranayam and anulom vilom strengthen our respiratory system.
कोविड-19 वायरस खास तौर पर हमारे श्वसन तंत्र यानी कि रेस्पिरेटरी सिस्टम पर अटैक करता है। हमारे रेस्पिरेटरी सिस्टम को स्ट्रांग करने में जिससे सबसे ज्यादा मदद मिलती है वो है प्राणायाम। सामान्य तौर पर अनुलोम विलोम प्राणायाम ये एक प्रकार से पॉपुलर भी है, ये प्रभावी भी है। योग की ये सभी विधाएं हमारे रेस्पिरेटरी सिस्टम और इम्यून सिस्टम दोनों को मजबूत करने में बहुत मदद करती है।
The observation of International Yoga Day in the past years has been marked by mass demonstrations in public places. Due to the COVID-19 outbreak this year, the main focus was on encouraging people to do yoga at their homes with participation of the entire family. Human Resource Development Minister Ramesh Pokhriyal Nishank has launched an online yoga quiz competition to promote integration of yoga in school curriculum. Speaking on the occasion, Mr. Nishank said, the objective of this competition is to create awareness and to motivate children to acquire comprehensive information from authentic sources on different yogic practices. He said the competition aims at developing deep understanding and motivating children to apply the understanding of these practices in one's life and living. The minister said steps have also been taken to promote active participation of students with special needs by converting questions from text to audio. We have a report.
The quiz competition is open for all students of class 6 to 12 across the country. The competition will help children develop healthy habits and lifestyle. The questions asked in this online competition will be multiple choice type and will be available both in Hindi and English language. Certificate of merit will be issued to 100 top scorers. The quiz competition will be open for 1 month and students can participate till 20th of July. It has been organized by National Council of Educational Research and Training. With Dipendra Anand Kumar, AIR News, Delhi.
Human Resource Development Minister Ramesh Pokhriyal Nishank has announced that the National Testing Agency NTA has launched the Hindi test feature on the National Test Abhyas mobile app. He said that competitive exam students preferring Hindi can now practice on their mobile devices with Hindi mock tests released on the smartphone application by the NTA. The minister informed that last month NTA had launched its artificial intelligence-powered smartphone app to empower engineering and medical aspirants to prepare safely from their homes for entrance exams including JEE Main and NEET. Mr. Nishank said so far over 16.5 lakh tests have been given by students on this app and more than 9.56 lakh students have downloaded the app. The Railways Ministry has taken an important decision to ease procurement norms and improve ease of doing business. A vendor approved for an item by any of the vendor approving agency of Indian Railways will be considered as approved vendor by all railway units for that particular item. Previously, vendor approved at one establishment was not automatically eligible to be considered for procurement at other establishments, and they had to apply for approval at multiple establishments to get considered. The ministry said this decision will impact vendors favorably as it will save time and do away the need of approaching multiple vendor approving agencies. This will also promote better utilization of manufacturing capacity of industry in the country.
India has become the 12th largest holder of US government securities at the end of the month of April, with holding worth $157.4 billion. The data from the US Treasury Department showed that after significantly reducing the exposure in March to $156.5 billion, India marginally hiked the holding by $0.9 billion to $157.4 billion, the the next month. India Meteorological Department IMD has said that the conditions are becoming favourable for further advance of southwest monsoon into some more parts of Madhya Pradesh, Uttar Pradesh and Uttarakhand from tomorrow. The monsoon will reach the entire western Himalayan region, Haryana, Chandigarh and Delhi, most parts of Punjab and some parts of Rajasthan during 24th and 25th of this month. Talking to AIR News, IMD official R.K. Jainamani said these regions will receive more rainfall in the next few days.
टेम्परेचर कम हो रहा है प्री मानसून थंडर शावर से। राजस्थान में अभी कहीं भी हीट वेव नहीं है और जो दिल्ली का जो रेन है वो पिकअप करेगा 23 पे और 25 को ज्यादा बारिश का संभावना है दिल्ली में। बाकी पंजाब हरियाणा में भी 24-25 को अच्छा बारिश का संभावना है। मानसून ऐसे भी इसी इलाका को 25 तारीख तक आ रहा है।
Now let us take a look at the weather forecast for today. The minimum temperature in the national capital Delhi was 25 degrees Celsius, while the maximum is expected to be around 37 degrees Celsius. The city may witness generally cloudy sky with light rains today. Mumbai will witness generally cloudy sky with light rain. The minimum temperature would be 28, whereas the maximum will be 33 degrees Celsius. In the south, Chennai will see generally cloudy sky with light rain or drizzle. The temperature will hover between 40 and 30 degrees Celsius.
Kolkata will witness partly cloudy sky with 1 or 2 spells of rain or thunder showers. The minimum temperature in the metropolis was 28 degrees Celsius, while maximum will be around 32 degrees Celsius. Chandigarh will witness generally cloudy sky with possibility of development of thunder or lightning. The minimum temperature in the city was recorded at 26 degrees Celsius. Maximum will be around 35 degrees Celsius.
In Dehradun, the temperature will hover between 24 and 33 degrees Celsius. The sky will be partly cloudy with 1 or 2 spells of rain or thunder showers. Whereas in Hyderabad, the minimum temperature would be 24 and the maximum is expected to be around 33 degrees Celsius. The city will face rain or thunder showers towards evening or night. Bangalore witnessed maximum temperature of 21 degrees Celsius and the minimum would be, Bangalore witnessed a minimum temperature of 21 degrees Celsius and the maximum would be around 30 degrees Celsius with generally cloudy skies with light rain.
Ahmedabad will witness generally cloudy sky. The minimum temperature was 28 degrees Celsius, while maximum will be 37 degrees Celsius respectively. Bhopal will witness generally cloudy sky with possibility of heavy rain. The minimum temperature in the city was 24 degrees Celsius. Maximum will be around 29 degrees. On to the north, in the Union Territory of Jammu and Kashmir, the minimum temperature was 27 degrees Celsius in Jammu, while maximum is expected to be around 42 degrees Celsius. The city will observe mainly clear sky, becoming partly cloudy towards afternoon or evening. In Srinagar, the minimum temperature was 14 degrees Celsius, while maximum will be around 32 degrees Celsius. In Gilgit, the minimum temperature was recorded at 14 degrees Celsius. Maximum will be around 35 degrees Celsius. In Muzaffarabad, the city witnessed minimum temperature of 17 degrees Celsius, while maximum temperature will be around 37 degrees Celsius with mainly clear sky.
And now an overview of today's newspapers. Reporting on the rise in COVID-19 cases, the Tribune headlines: record 15,000 spike, cases doubled, 4 lakh in 18 days. The Asian Age riots, 4 lakh plus COVID cases in India, up from 3 lakh in just 8 days. The fallout of the pandemic is highlighted in Business Standard. India Inc. conserves cash, cuts costs on war footing, while Hindustan Times reports that traffic is higher than pre-lockdown level on metro stretches in Delhi. The Indian Express quotes Rajnath Singh as saying to top military brass, "Don't want escalation, but if China acts, give befitting reply." Rajnath to the top brass. And work from home boosts demand for study tables and e-classes have led to higher sales of laptops and PCs, reports the Times of India.
And now, before we end the bulletin, the headlines once again. Home Minister Amit Shah reviews coronavirus situation in national capital. Calls for fresh demarcation and strict monitoring of containment zones. Mizoram extends total lockdown till 30th of June. More than 2 lakh people successfully cured of coronavirus infection so far. Defence Minister Rajnath Singh asks top military brass to ensure strict vigil on Chinese activities around land border, airspace and sea. Centre sanctions 190 crore rupees for augmentation of healthcare facilities in northeastern states. Procurement of minor forest produce by government touches an all-time high, giving boost to tribal economy. For details of these stories and more, log on to our website www.newsonair.com. And with that, we end the morning news. Have a nice day.